As an organisation, we've been focusing on risk for a very long time, and we report that through all of our governance levels from frontline right through. But what we identified was that we had quite a complex system, and we didn't know that we were actually at world's best practice again, so we decided that we'd have a good look at that. This was led by our board chair asking us to do a full review. So as an organisation, we were really lucky because right from board level through, there was great interest in what we were doing here, but interest for change as well. And I think that was a really key part of what led us down the process. The other thing that was also very useful for us was the advice that we received from BMIA. We got a little bit of feedback as to whether we were at industry best practice, and we were deemed to be round about where everyone else was, but together we identified that there was an opportunity to do things differently.
We had an enterprise risk register that was very focused on our core business around meeting patient care, providing a safe environment, all of the things that are absolutely critical to what we do, but we probably had some opportunities to closer align how we approached risk with our strategic goals. So we had have an organisational vision and a mission, and we have a number of strategic goals, and some of those are quite aspirational, as they should be. So we wanted to make sure that we were thinking about what the risks were to achieving some of those strategic goals, not just the risks of our sort of day-to-day operational business. The first priority was to ask ourselves, what does this actually need to look like? What should an enterprise risk register look like? How does that differ to the rest of our risk registers? How do they all align? And I guess the biggest question was, are our risks focused on our strategic objectives? Do we really understand what's going to stop us meeting our strategic goals and striving to be the organisation that we want to be? Given our core business is providing patient care, we're very good at identifying what our clinical risks are. I think that's something that is well embedded in our practice, and we know what they are, and we're good at identifying them, and we're good at addressing them. Perhaps where the opportunity for us was to start to look at, okay, well, what are some of the other risks that affect us? And that could be around our people and culture, it could be around workplace health and safety, some of our IT risks, some of our financial risks. So looking at all the other categories of risk was the first sort of starting point, and then started to think about, okay, well, of our strategic goals, what are the risks to meeting those? And so we were able to sort of group up the different categories of risk to meet our strategic objectives. So for us it was, okay, well, we know we've got some clinical risks, but if we have a strategic goal to provide exceptional patient care, what are the things that are going to stop us achieving that? Is it that patients are falling over or getting pressure injuries, or is it actually more about our culture and our change management practices, how we communicate with our staff? So just really starting to ask ourselves the question of what's going to stop us achieving our goals, as opposed to focusing on the things that the current incidences or hazards or the things that can go wrong in hospital.
The appetite for change as we worked down through the organisation was actually different than that at board level. So at board level there was an understanding and a leadership of change, but for people working within the sites, for example, because we have three different enterprise levels, we've got our enterprise risk, our operational and our sites, and so it's actually how you map the site through to the enterprise and help people see the relevance of what they're doing and how that will come through. So we had two people who actually worked in this project as project managers to work with people to actually help, first of all, see the requirement for change or the necessity for change, to actually get some input into what that change could look like, to get feedback as we were actually moving that, and to go forward. And it's like every change, not everybody is running out there leading it and saying this is fantastic. But what we have to do is actually make sure the explanation and the understanding, but also the outcomes. We are incredibly lucky as an organisation. Our frontline staff want the very, very best for our patients. And our biggest part of our risk registers are around patients, but there's also then the enterprise risks. So what we could do was actually show them and help map that through and provide them with a framework as to how they bring that back through to the executive and to the board, because all of our risks come through our board quality or our board audit process, and it's the frontline staff that actually have the opportunity to come and present those.
We ran over 18 different workshops across the organisation with all the different program areas, not just clinical. So we met with our engineers, we met with our support services, we met with our IT team, our communications team, our people and culture or human resources team. So we targeted all the different groups as well as the clinical areas and pretty much asked them what's going to stop us from achieving our objectives. And so we, rather than saying what are the risks or what worries you, it was a shift in the question of what's going to stop us achieving our goals and objectives. We couldn't have done this without the board or the executive buy-in, and so I guess you need your ducks to line up nicely. The timing needs to be right. You need to have the right people on board and the right people influencing. You need to be the right person to influence that direction, and how you go about it needs to all line up. So part of it was really talking to the board and the executive about selling it to them as a way of we're looking at best practice. We're wanting to benchmark, we're wanting to align with our strategic goals. So we lined up the, I guess the burning platform for making these changes was aligned directly to what we're trying to achieve as an organisation. So that was the first sort of selling point. Then it was about taking them on the journey as to why this is a good thing to do. So giving them some examples, explaining what the difference would be, why it's important. Again, keep coming back to how it will help us achieve our strategic objectives. But also I think that we made this about us being a leader in this space. So as far as the healthcare industry goes, how can Monash Health really stand up and lead by example and, let them know that we were doing something new, that this was evolutionary, but that we really wanted to sort of strive to be leaders in this space. And so that was a really positive outcome as well.
My advice to other organisations is be brave. It is incredibly uncomfortable to actually challenge your risk register. It is uncomfortable to throw your whole risk register up in the air, something that has worked for you for a long time and that you have a real comfort level for. But be brave, because what we have found is a whole lot of different risks. We're articulating them differently, and what that's leading us to is mitigating them differently as well and testing those mitigations. We now rate our risks against unmitigated and mitigated so that we actually know what that true risk is. But what we've also had to do is encourage others to come on the journey with us, encourage others to take the risk and to mitigate their own risks as they're changing their risk register. And that sounds a little bit strange, but it's an incredibly important thing to do. It's about not losing the relentless focus of delivering what you've promised to deliver. It's about saying the same thing 10, 15, 20 times and ensuring, even though you're feeling that you have repeated yourself, knowing that those people who are hearing it for the first time or hearing it differently. So be brave, but I think my biggest piece of advice is put a very strong change process around the risk register review. We had a number of learnings as we've gone through this, as you do with any change project. I think the first learning was the importance of leadership understanding, and I mean leadership at every level of the organisation. The understanding at board level, at board subcommittee level, at executive level, and then at the senior leadership level across the organisation. I think we had it at the chief executive, chair, and some board member level, but we didn't invest enough time in ensuring there was the understanding from everybody as to why we were doing it and what we were trying to achieve. So we'd probably put a little bit more time in next time. The next thing was around looking at all of the different ways of communicating the change that we're doing. We tended to have one or two models that we used. I think in future we'd broaden that and maybe use a little bit of audio and video to get our message out a little bit broader. The next thing was how we shared the learnings along the way and took everyone with us along the journey. And I think you can always learn more on this, but ensuring that everybody does come on every step and using maybe a change house model or a different specific model to help us move through the different areas and to mitigate any resistance that was there.